The 800 CHAB Family First Radiothon has changed places on the calendar this year. It usually happens in the spring, but with the COVID-19 pandemic, that date has changed. It's now set for September 10th and 11th, back at its original location at the Town and Country Mall in Moose Jaw. The theme this year is Healthcare Heroes, and we have one of them on the phone right now, Dr. George Miller. Thank you for taking the time to talk to us, sir.
Anytime, Barry. It's always a pleasure and a great honor.
How long have you been practicing medicine in Moose Jaw now, sir?
34 and a half years, almost 35, a little bit. I retired from active practice in December last year, so I just missed the COVID stuff coming up in February. It was quite a shock to the whole system, and the healthcare system was there, and we were all kind of sitting on the sidelines waiting to see what happened, but luckily we didn't get whacked like some places did, and we were prepared.
You've certainly seen the pandemic, I think, differently than a lot of us have. What's it been like for people working on the front line in the healthcare industry?
Well, we were having to retool and retrain. We had to align our interests in order to keep patients alive. We had to look at how we ventilate, how we manage things. We spent a lot of time studying this. We educated ourselves. I went back to school and spent a lot of time online with learning because we couldn't do group learning as much, but we did practice runs on emergency intubation, how we would operate on patients, how we clear the room, how we can operate safely and support people over this. This is a disease that affects us all, and it affects our friends and neighbors, and we have to take care of our friends and neighbors here, as we've always have in Moose Jaw.
You mentioned going back and getting more education, even after 34 years in practice in this community. Learning never stops, right? It's always changing.
It is, and that's the reason why we have to change equipment and our priorities. And we align our priorities as directed by the Saskatchewan Health Authority. Our government was quite effective and on top of this. They briefed us. They told us what was going on. We put up emergency websites. If you spend the time as a health professional, you could educate yourself quite quickly on these. University of Toronto had excellent courses. There was video conferences that we could do. The Zoom meeting suddenly became much more important. And so through things like that, and for my specialty, which was in general surgery, we went through the Canadian Association of General Surgeons, who had some meetings. And, you have to deal with what you got, but luckily we didn't get the whack that New York or the Italians got, so we were very happy.
You mentioned the Zoom meetings. It always reminded me when I was in those of the old Brady Bunch television show with the 6 different people in the squares, right?
I'm not adjusting to them terribly well. I like listening in on them, but I'm supposed to chair some Zoom meetings, and I just can't do it.
Yeah, it's
a different generation that can handle it.
It's a brave new world. Yeah, it is.
Yeah, it is. It is. And luckily we've got the infrastructure to do that. The FH Wigmore Hospital is set up well for the IT infrastructure. All our ORs have got negative pressure rooms. We can add additional negative pressure rooms where we need to manage people on the ward. So we're in good shape. Emergency flow was unloaded for a while, which was good, gave us a chance to prepare. Now it's overloaded with emergency because we had it's the people without COVID, the other people that got pushed back, the diagnostic procedures, our cancer surveillance. Those things were important too, and we've had to do it. And now we're preparing for the fall. So the fall is a different time, and we're going to see what happens. We want everybody to get their flu shots and be prepared for this. Even the flu shot can help prevent unnecessary respiratory infections. So when that comes out, I want everybody to be encouraged to talk to the doctor about it, talk to their pharmacist, get the damn flu shot. It helps to eliminate a lot of problems and will keep you alive.
Yeah, good advice right there. Let's talk about the Radiothon coming up September 10th and 11th back at the Town and Country Mall in Moose Jaw. Over the years, Dr. Miller, it's raised over $4 million, which has made a real difference for healthcare right here in Moose Jaw and for patients right here in Moose Jaw.
Isn't that amazing? It's amazing how generous Moose Jaw is, and as I've told people, it's been my honor to care for people in Moose Jaw. Moose Jaw has been very, very good to me and my family. We continue to live here. It's a different time of my career now, going into semi-retirement where I'm assisting. But my daughter practices in Regina. She's a general surgeon like myself. I've had a chance to go and assist her in Regina, and And that speaks well for our community that we could raise children and educate them and have them. I never expected her to take my specialty, but have them practice in the province, and it makes us all stronger and better.
On a personal level, that must be a very proud moment when you can work with your daughter like that.
It really is. Sometimes it's a little tense in the OR, but we actually enjoy each other's company, so it's a pleasure working with her.
The money that we raise brings in new equipment and things we need at the hospital, and that's important not just for patient care, Dr. Miller, but it helps us recruit new professionals and a higher level of talent to work in our community, right?
Absolutely. We're going to be back to a full complement of general surgeons here shortly. Come the fall, we've got Dr. Chow joining us. We have a new urologist who's joined us. We have 3 orthopedic surgeons, 3, count them, working in the city here. And this makes it a lot better. If you've got more horses pulling the load, it's better for everyone.
And you compare that to where we were not that many years ago, we're in a much stronger position now, aren't we?
Yes, we are. And thanks to the hospital and the equipment we've got and the community that's raised the money for that equipment, that's made a big difference overall to our recruitment efforts. But the fact of the matter is that we've been able to recruit these specialists now over time through concerted efforts through administration and our medical staff, that we can keep a full complement of specialists here and keep our staff active and caring for the people of the Moose Jaw District.
Right on. Okay, the Radiothon goal this year is $195,000, and we can talk now specifically about some of the things we're looking to buy, including a new defibrillator, which Dr. Miller is really about saving lives, isn't it?
That's right. That's the crash cart. That's when things all go to hell. we really don't want that to be used that much, but it is necessary. People go into fast atrial fibrillation, and a quick jolt of the heart can get you back into normal sinus rhythm, and it's magic. It can actually convert a patient who is going away very quickly to a beating heart and a chance of life.
Now, the defibrillator is part of the crash cart. Do I understand that correctly?
That's right. And between the two of them, it's an integrated system that we bring into the place like the OR, the ICU, and the ward, which allows us to do all these things at the same time. It's about $36,000 worth of equipment, and it doesn't come cheap. They do get used on a regular basis. That electrical energy contact is now coordinated. There's newer computer programs that allow us to shock just at the right time. These are important advances in technology. Just like we've had advances in our telemetry and cardiac monitors, these now, even though we've got a fairly new hospital, these are getting outdated. The cardiac monitors especially are getting outdated. So these monitors are necessary to track and record the electrical activity of the heart, to detect when people are showing dysrhythmia, to allow us to intervene sooner rather than later. And we can detect the potential rhythm like that before it becomes into problems. The nurses who are there, who are carrying you minute by minute, and at the bedside, can recognize that and alert the doctors to that. And that runs about $20,000 in itself. And the whole telemetry system is the big thing. When people wander around the hospital with all those wires hooked to them, we need that. That tells us a lot of what's going on.
So that's what a telemetry system is.
That's right. It's distant monitoring. It allows you to be up and moving around. Well, you can't move much in the hospital these days. You can put them in an ER and the ICU, in the OR even, when we switch you back to telemetry and you're in recovery for the few days of post-op care that you're there. That monitors you, and it's relayed to the nurses that can interpret that in the ICU, and your doctors can receive strips. And that is going to be like $50,000 right at the present time. And they are amazing. And the ability to be able to do that as you move around the hospital is important. It's a pain carrying all these things, but it's there.
You know, time seems to be such an important factor in all of this. The sooner you can get the information to the professional that needs the information, the sooner the appropriate treatment can be administered to the patient, right?
That's right. And our outpatient care is important, too. We are still chronically short on internal medicine. We're hoping to have at least 4 to 5 internists available here, but we're hoping to acquire new Holter monitors, too, for them. A Holter monitor is what you wear to detect cardiac rhythms when you're outside of hospital. And if you've got people who've been a little dizzy or lightheaded, what's going on here. We would like to check on that, and a Holter monitor is important for that. We're also looking at new pulse oximetry monitoring as well. I think there's a good case that people should be monitored for their pulse oximetry outside of hospital. It can be an early alerting symptoms of respiratory distress. And we're learning that they can be important too.
Pulse oximetry, what exactly is that in layman's terms?
Well, that's how we measure the oxygenation of your blood. It's the efficiency of oxygenation. And it's that little clothespin that goes on the end of your finger when you're in a hospital. It can be clipped to various appendages. It uses the color of your blood, literally, by shining a little red light through there to tell how much oxygen is in the blood. And it's one of the early signs of respiratory distress is your oxygenation comes down. That's what we found out with COVID and other forms of adult respiratory distress syndrome. The first thing is your lungs are not as efficient. So there's a sudden drop in your oxygenation levels. And people think they're dizzy and lightheaded. Well, there's important things to monitor there. But we do both with Holter monitor, and a lot of times we do a lot of pulse oximetry that our respiratory technologists handle.
I know chemotherapy chairs are on the list of wants and needs as well.
Yes, we're doing more and more of this. Outpatient chemotherapy is done here now. When I first started here, chemotherapy was all done in Regina. But now that we know that preoperative chemotherapy is important in a lot of management of cancers, we do know that postoperative care is there. We do know that lymphoma, non-Hodgkin's lymphoma, is being managed better and better with chemotherapy. A lot of cancer is now a chronic illness. And by that, we mean you get chemotherapy at various times to intervene for things like lymphoma. So, as you well know from personal experience, Barrie, I don't think we've talked about this before in the area.
Indeed, we have, yeah.
You were first and foremost to look at that. And, hey, we're both this side of the daisies, and that's a good place to be, Barrie.
Absolutely. Yeah. And I thank you and all the professionals for the great support that I had, because my personal experience, was just terrific here in Moose Jaw and at the Blair in Regina. But I remember the travel I did back and forth, and that can become taxing. And having the ability to take the treatments in Moose Jaw closer to home benefits the patients, benefits the families, better for everybody, isn't it?
Absolutely. And it's just better for the people overall. It's a long road to hoe, and if you can cut down on the travel time, make it easier for people to receive this and get the treatment you need, it's in a much better frame of mind to allow you to maintain the strength and to help you over your cancer and help you with it.
Yeah, we've got a lot of needs, and we've got a lot of support, and the Family First Radiothon will keep pitching in. It's coming up September 10th and 11th, the Town and Country Mall in Moose Jaw. The goal this year, $195,000. I suspect we will see you there, sir. Hope we do. It's always great to have you.
I hope to be there. I'll have to be the guy with the mask on. Regular bit of asthma that I have to manage with, so I always got my mask on. And I appreciate those people in the businesses in the town that have done that. I know these are tough times. Everybody's worried about the income and your jobs and all the rest of it, but the money that we raise goes directly to the people that need it a little bit more than we do. So if you can find it in your hearts and your wallets to be able to give, please give what you can.
Amen. Dr. George Miller, we look forward to seeing you soon, sir. Take care, and thank you for your time today.
Thanks again, Barrie, and appreciate you and the rest of the people at Golden West for helping us out with this. Like I said, all radio is local, but you are particularly good local supporters, and we appreciate it.